Daseinanalytic psychotherapy is able to create a unique realm which is shared by the client and the Dasein analyst. This realm is not produced like a product, like an artifact. It develops by itself, it shows from itself. This therapeutic realm is created by the therapeutic relationship, by the openness of our client, and by the serenity of the therapist. This realm is not unlimited. We have certain prerequisites that are necessary to warrant this therapeutic realm, this therapeutic relationship. We call these prerequisites the setting of psychotherapy. They are not strict rules, but these are recommendations to help the client open up as much as possible and to help the therapist to remain as serene as possible. One point of Daseinanalytic setting is the duration of each session. Each session is limited to 50 minutes. This is important for everybody, not least for the patient, to know that we have enough time in our life to discover relevant, authentic things. 50 minutes are more than enough to reveal authentic possibilities in dreams or in our everyday life. We often hear from our patients at minute 49, could we please make a longer session? Now I'm starting to open up, now I'm starting to discover new things. Please let us continue 50 minutes. Please let us continue another 50 minutes. We don't encourage that, we don't recommend to extend the length of a session too much, because this will show our patients that they have to focus earlier, they have to focus on relevant things from the beginning of the therapeutic session. The other important point in Dasein analysis is the frequency of therapeutic encounters. We recommend to meet at least once, better 2 times per week for psychotherapy. This will enable a more deep and more profound therapeutic encounter. This will help us to remember all the relevant things. We are not saying that all the details that are forgotten after a psychotherapeutic session are a mistake. We are trying not to make too many notes as therapists during psychotherapy, and we do not encourage our patients to make notes during the therapeutic session or after the therapeutic session. We are absolutely convinced that everybody will remember the authentic, the relevant things. But the setting will help us to remember those relevant things if we meet at least once or better twice per week. Another important thing in the setting of Dasein analysis is the couch. We are convinced that lying on the couch is the best position for the client to focus on himself, to focus on those phenomena that have not been discovered yet, that have not been allowed yet to show up in everyday life. And it's also better for the therapist if he is not looking face to face to his client, but is able to concentrate on all the phenomena that are showing up from themselves. We think that the couch shows things that are impossible to reveal in another setting. We emphasize that the couch is not the best setting for each patient. There are types of psychopathology where our patients are not able to lie on the couch. This is our responsibility as an analyst, to realize which patient is ready for the couch and which patient is not ready yet. However, we try our best to make our clients ready for the couch as soon as possible, because we are convinced that this is the more effective way of discovering authentic possibilities in life. The frequency of therapeutic encounters is also important to give our clients the feeling of importance of Daseinsanalysis. Daseinanalysis is just not some medication that you're taking twice daily or twice weekly. This is a very important relationship in your life that you have to appreciate. So in those situations where patients do not show up at the session, this is more than just a forgotten date. We assume that there is a deep reason why patients forget their appointments, why they come too late. This is something that we address during the following session. Is there a reason why I came too late? And there are always excuses. And we accept, of course, all these excuses. But we are aware of the fact that this is a sign that our therapeutic relationship is not working perfectly. We are looking for those deficits, maybe in my serenity, that could explain why our patient is coming lately or is not showing up at all. So there is no phenomenon in the therapeutic relationship which is not of importance. Other psychotherapeutic methods have a lot of different settings that we do not encourage in Daseinanalysis. As I mentioned before, the setting is not a dogmatic law. There is nothing forbidden during Daseinanalysis, but there are certain things that we do not encourage. We do not encourage physical contact. There are therapeutic methods that focus on physical contact that are definitely helping the patients as efficiently as Daseinanalysis, but with a different goal. I think that the therapeutic setting helps us to reach a very specific goal. Our specific goal is to let our fellow human beings know what they are themselves, what their authentic possibilities of being is. A different setting with physical contact or using arts, using painting, using music, they're all equally efficient, but they're aiming at different goals. And this is our responsibility as psychotherapists, as Daseinanalysts, to tell our patients frankly in the very first session, this is the setting that I recommend. I recommend it because I'm convinced that this will help you best to find your very own possibilities of being. But there are probably other settings that help you more to get rid of your symptoms, for example. If you do not want to know your own possibilities of being, then probably another setting will help you more.